to bridge this session with the 2 days we had, yesterday and the day before, up to Nancy Brown coming and talking to us on Go Red for Women movement. So just to give you a little bit of a backdrop, as many of you know, Wednesday and Thursday this week, some of you participated in the World Heart Federation on coronary artery diseases in women. This year, pre-summit forum brought much needed attention to an often under-recognized dimension of cardiovascular health, coronary heart disease, CAD, in women. What emerged from the discussion was a clear and urgent message. There's not only a story of biological differences, but of persistent and systematic gaps in understanding, detection, and equity in care. Participants explored how clinical practice must evolve to better serve women, improving screening methods, recognizing symptoms, patterns that differ from those traditionally thought, and designing health systems that don't overlook women's unique needs. The forum underscored the importance of moving from insight to action, refining how we diagnose, treat, and care for women with CAD. A powerful moment came through the voices of patients themselves. Their lived experience provided a compelling reminder of what's at stake and why the future of cardiovascular care must be grounded in empathy, responsiveness, and inclusion. The forum concluded with a resounding call for continued dialogue and collaboration across disciplines, geography, and sectors. Advancing sex and gender responsive care will require collective efforts of researchers, clinicians, policymakers, and patient advocates. Heart disease and strokes are the leading cause of death worldwide. And yet, women's health has been underfunded, understudied, and undertreated for far too long. We have the privilege and opportunity to hear more of this critical issue from Nancy Brown today. She will talk about the Go Red for Women movement. I let my colleague, Bojana, introduce Nancy. Thank you.
Thank you, Finn. I said at the beginning, I'm a firm believer of our ability to solve the world's biggest problems, and in front of us we have a solver of our problems in the face of Nancy Brown. I am delighted, I am honored to introduce you. You are the CEO of the American Heart Association, and under your leadership, the association has become a global authority on cardiovascular and brain health. The American Heart Association funds groundbreaking research, advocates for the public's health, and provides critical resources to save and improve lives affected by cardiovascular disease. Together with 35 million volunteers, supporters, and staff spanning 100 countries, Nancy advocates health and hope for everyone, everywhere. As a testament of her visionary leadership, only a week ago, Time magazine awarded Nancy as one of the leaders in global health under the category Spreading Heart Health. Nancy, the floor is yours to inspire us and give us the hope we all need.
Good morning. It's certainly wonderful to be here with all of you, and I'm very sorry I wasn't able to be here for the Global Women's meeting. I heard it was spectacular from my team who was here on the ground. But I'm honored to be here today, and I want to thank Dr. Nurullah for the invitation to join you to talk about a subject near and dear to my heart, and it's the American Heart Association's Go Red for Women campaign. I really was inspired listening to the last session because I think what we've tried to do at the AHA are to take all of the problems and to figure out how people themselves can help better have awareness and to own solutions. And I think Go Red for Women is a great testament of that. Okay, now we're going to see if I can use this clicker. No. The downward arrow. Okay, let's try again. Who am I pointing at? Right here? I'm going to go back one. There we go. So let me just start. This was said in the introduction, but I do want to mark that the American Heart Association celebrated 100 years of impact just last June. We're in our 101st year. And I would like to say that during that time, whether it's the trailblazing work of our founders or of volunteers, scientists, and clinicians throughout that time, the American Heart Association has always been dedicated singularly to the improvement of health for everyone, everywhere. And we're very proud that over time our work has expanded to, as was said earlier, to over 100 countries and 6 physical offices throughout the world where we really focus on collaboration to make sure that the resources of the American Heart Association can be spread throughout the world. As we heard earlier, heart disease and stroke are leading causes of death in the United States and around the world. And this really is the impetus for the creation of Go Red for Women. We know that when women don't understand to begin with that heart disease is their greatest health threat, it's hard to take action. And we recognized all the way back in 2004 when Go Red for Women was created that although heart disease was the greatest health threat to women in America, that most women did not understand that. They felt that breast cancer was their greatest risk or other forms of cancer, not heart disease. And we know, at least in the U.S. and likely in world statistics as well, is heart disease is the greatest cause of death, more so than the next 3 causes of death combined. And so we recognized we needed to take urgent action, not only to implement more proven solutions on behalf of women, but to help raise awareness of women. Let me just say that in the United States, almost 50% of all women over the age of 20 have some form of cardiovascular disease, a risk factor for cardiovascular disease. And we see that throughout the life course of women, there are actions that can be taken. We know that we can start raising awareness through various components of the Go Red for Women campaign that we have implemented over the years. The first is it relates to raising awareness of women themselves that heart disease is their greatest health threat, is an activation that we have done since the very beginning. It's called National Wear Red Day. In the United States, the month of February is designated as Heart Month. It has been designated by every United States president since the 1960s. And during the Heart Month, the first Friday of February is National Wear Red Day. And we really call this a day of awareness. I'm proud that since the beginning of the Go Red for Women campaign, the percent of women in the United States who understand that heart disease is their greatest health threat has increased by 47%. But we recognize we have a lot of work to do, especially with younger women and women in under-resourced communities that may not recognize this fact. So we use National Wear Red Day to spread awareness in communities with influencers and through digital social media of the kinds of things that that women can do to take action. We know that Go Red for Women in the U.S. is a brand that 80% of women believe that they can trust and support, and so that is a great thing. This past year on National Wear Red Day, we focused on the importance of CPR in women. We have a campaign that's kind of parallel to Go Red for Women called Nation of Lifesavers, where we seek to make sure that everyone everywhere has access to the life-saving skill of CPR, an initiative that the AHA has led since, again, the 1960s when we created the first practice guidelines for CPR and resuscitation in the United States. We know that women do not receive CPR at the same rate as men. And this is a statistic that we hope to change. And so during National Wear Red Day this past month, past year, we focused on this. We also focus on what we call Life's Essential 8, the 8 health factors and health behaviors that are critical to achieving ideal cardiovascular health. And National Wear Red Day has been an anchor of Go Red for Women. Here are some of the highlights of this past month, past Heart Month, where we had hundreds of news anchors in the United States wearing red on National Wear Red Day, lots of social media coverage. We have landmarks going red in the United States as well. And then we have a highlight of celebrity engagement in the association through our Red Dress collection. The Red Dress collection is the opening to Fashion Week in New York City. And so we're able to inspire people, not only those who come to the Red Dress collection, but also to those who are able to view it online or through social media. You can see we had over 4 billion media impressions from the Red Dress collection. It's really important because we inspire celebrities who are survivors to join us, or those who have persons in their family who have survived cardiovascular disease. This year, Sharon Stone, who a famous actress who herself suffered a stroke a couple of decades ago, was the MC for the Red Dress collection, and she powerfully told the story of how embarrassed she was for years to speak about her stroke. And now she's become a strong advocate for women to understand the risk factors and warning signs that she herself didn't know prior to her suffering her stroke several years ago. And this is where we inspire women everywhere to tell their stories. And in the last session, we talked about the lived experience. And I would say that one of the powerful aspects of Go Red for Women is that this is a movement owned by women. We have women in communities throughout the United States, and as you'll hear in a moment, throughout the world, actually, that participate in Go Red for Women. And we listen to these women about what will motivate them to take action. And we tell the stories of real people who have suffered cardiovascular disease. What we have recognized through Go Red for Women, and frankly through all the work we do at the American Heart Association, is that many of the types of things we do to change systems, to inform physicians, to change public policies, all of those are important foundational aspects. But if people themselves are not inspired to take action, nothing, frankly, will change. You know, people will not change their risk factors, take their medications, go and see their healthcare provider if they're not inspired why that is important to them. And so we recognize that survivors from throughout our communities are very important because they can reach people just like them and help engage people in the cause. One of the other ways we engage people in the cause is through our work in grassroots advocacy. Advocacy is a major pillar of our work in the United States, and certainly a priority for the American Heart Association. And certainly we advocate every single day on behalf of women, and we engage women in this advocacy. Let me just give you an example. In the U.S., 43% of all births are paid through Medicaid, which is a joint joint federal and state program that provides health care to low-income individuals. We have invested significant resources in our state advocacy programs and in our federal advocacy program to extend Medicaid coverage for postpartum coverage for women so that women can access much needed health care after their baby is born. To date, 47 states, including Washington, D.C., have implemented this important Medicaid expansion priority. And that's a real testament to the work of the power of voices speaking out on behalf of issues and causes that really matter. And we couldn't be more proud of our work in advocacy. We're also equally as proud of the global collaborations that we have, bringing Go Red to women to life in countries throughout the world. We have over 60 organizations in 55 countries that include local societies and foundations that are partnering with us, doing things like knowledge sharing, awareness and education, advocacy campaigns, health screenings, professional education to help make sure that our physician workforces in countries understand and can activate on the Go Red for Women campaign. We implemented and created a research registry for women by women called Research Goes Red. As we heard in Finn's introduction, we know that women are not diagnosed equally to men. They are undertreated, underrepresented in clinical research, and often sent away from emergency rooms, at least in the United States, when they present with symptoms that could be related to having a heart attack. And so at the AHA, with research as one of the foundational pillars of our work, we knew we could do more with our resources. So alongside our partner at that time, Verily Life Sciences, we created Research Goes Red, which is a clinical practice registry. And we know that the purpose of this is to get more women directly engaged in research. We have right now about 30,000 women that are part of this research registry. And one of the first things we did was we asked these women, what do you think is important that we should spend our resources studying as it relates to you and your health? And the three things that they came back with, number one, were weight changes during menopause. Secondly, social needs and social support as it relates to social determinants of health. And the third is hypertension management. And so we've launched a number of data grant awards using the Research Goes Red database, which is housed on a technology platform that we have at the AHA called the Precision Medicine Platform, where the data is open access and available to people. And we funded these research awards. I'm very proud that just recently one of our awardees, Dr. Brooke Agarwal of Columbia University, took the data that she worked on through her Research Goes Red grant, a modest, $400,000 or so award, and she just received a $4.5 million NIH R01 grant to continue her study in this area. And so, that's just an example of the power of making resources available to researchers who care passionately about closing the treatment gaps for women everywhere. I'll mention some other, let me go back up. Women-focused research that we support at the American Heart Association. The first I'll mention is our Go Red for Women strategically focused research network. The AHA Board of Directors committed $15 million to support 3 centers of excellence in women's heart health. And thanks to the generosity of one of our donors, Sarah Ross Soder, who contributed initially $5 million and then an additional $5 million, so $10 million, we have an in-depth program at NYU under the direction of Doctors Judith Hochman and Harmony Reynolds studying MINOCA in women. And we're making great progress on better understanding the biomarkers for MINOCA, and we're really excited about that work. We also have funded a cardio-kidney metabolic syndrome heterogeneity in women strategically focused research network that is a $15 million network that was just launched last year, studying again specifically CKMH in women. And then we're very proud to partner with a number of organizations, including many of you in this room, on the International Research Challenge on Women's Cardiovascular Health by the Global Cardiovascular Research Funders Forum, and you see the amazing partners that have come together here to support this. And this is a $10 million award that will be provided. More recently, the American Heart Association launched AHA Ventures. We've had a venture fund focused on diagnostics and cardiovascular health for 10 years called Untitled Chapter. We made the decision about a year and a half ago to bring in-house the venture capital activities of the AHA. So we have AHA Ventures led by a longtime woman venture capitalist, Lisa Sunan, who is leading this work for us. And in AHA Ventures overall, we have a new Go Red for Women venture fund, which I'll talk about in just a moment. We have a series of social impact funds where we've made over 100 investments in community organizations solving problems like food insecurity, access to health care, hypertension screening. We have Cardiation Capital, our diagnostics fund that I mentioned. And then we have Studio Red, which is an in-house innovation incubator where we are actually creating companies that are focused on solving cardiovascular disease problems. The Go Red for Women Venture Fund is something I'm especially proud of. We recognize that investments in women's cardiovascular health and venture funding are really embarrassing. We co-authored a study with Deloitte that showed that there were $43 billion spent on healthcare venture investing in the United States in 2023. $43 billion. Of that, less than 2% was focused on women's specific health issues. And of that 2%, only a fraction was spent on cardiovascular, heart, or brain health. And we knew we needed to do something to be a catalyst to making that change. And so the AHA board gladly launched this fund with a $40 million set aside of allocation of resources. And then our wonderful donor, Sarah Ross-Soder, I talked about her a while ago, contributed $15 million, and we're in the process of finalizing $20 million more dollars, so we'll have a fund of $75 million, and we're about to make our first two investments. We've created an in-house team of women health experts, as well as a dynamite scientific panel that are helping us with our investment selections. And we are very excited. Hopefully next year we can tell you more about some of the companies we are investing in. And the last thing I would just say is that we hope you will join us on this mission of helping women understand the health threat of heart disease to them. I can tell you, every single day I have an opportunity to interact with women who are survivors, people who have lost women in their family because they didn't know and recognize the warning signs, people who from all over the world who are not able to have access to essential medications and health care that could provide them a longer and healthier life. And as we at the American Heart Association seek to fulfill our vision and our mission to provide health and hope to everyone, everywhere, our focus on women's heart and brain health stays a major priority for the organization, whether it's through addressing it through our scientific agenda, through our advocacy agenda, through our public awareness agenda, or through listening to women themselves tell us what's important. There are so many stories of women who have been misdiagnosed or undertreated. And I can tell you one that's very close to my heart, and that is of my own sister, who back in 2014 suffered 2 ischemic strokes because of undiagnosed atrial fibrillation. And when, we weeded through all of the problems that she was having, Luckily, she was transported to an American Heart Association certified comprehensive stroke center where she received excellent care and has very minor limitations today. But, atrial fibrillation is a really increasing cause of concern for women in the U.S. and around the world. And, when we think about issues about women's heart health, early diagnosis and early treatment are really critical. And when we aren't able to intervene early, either because people themselves don't know the warning signs or the system isn't identifying those when people present with symptoms, we've got to do something to make a change. And I think the World Heart Federation and all of its member organizations are key to making this change for women everywhere. Thank you again, Dr. Narula, for the honor of being with you today, and I will turn it back to the esteemed panel. Thank you. Do you want me to sit here? Yeah. Thank you.
Thank you, Dr. Jagat Narula, for inviting me on this very prestigious World Heart Summit. In this session, a very learning experience and hearing Nancy. And the American Heart Association for the last 20 years is working on this project and this campaign, which is a very important, not only developed but for the low socioeconomic status countries. I think there is a need to expand this campaign to other countries as well. And as you said, that 7th February every year is a very important day to make it more powerful, this campaign. And on the behalf of everyone here, I could like to extend a heartfelt thank you to Nancy for her leadership and dedication to Go Red for Women movements. Especially the American Heart Association has done a tremendous job in creating the awareness, education, research, and campaign in the communities. And to create the revenues, generate the revenues at the local and the country level at different places is a tremendous job done. It has been extraordinarily instrumental in raising awareness and driving changes in women's heart health. As we continue to confront the global burden of cardiovascular diseases, it is crucial that we keep women's health at the forefront of our effort. The problem is that most of the women are not aware that they have some problem related with cardiovascular diseases, strokes, arrhythmias. The work being done through this movement is a vital step towards ensuring that women everywhere receive the care and attaining a deserve. We must continue to advocate for and invest in research, education, as I said, and various solutions that address the unique cardiovascular risk among the women. I'm extremely grateful to you, Nancy, for being a true champion and a role model for this very important cause. Thank you very much.
Thank you, Nancy. Thank you, everyone.